Dr. Audrey DeClue. She is an equine sports medicine veterinarian, graduate of Ross University of Veterinary Medicine, and the host of the Horse First podcast, a widely respected equine podcast focused on mystery and unsolved lameness cases. Through her work in clinical practice and podcasting, Dr. DeClue focuses on understanding the why behind performance problems, rather than isolating a single sore limb. Her approach challenges traditional sports medicine by emphasizing whole horse diagnostics, pain recognition, and the overlap between neurologic, musculoskeletal, and biomechanical dysfunction. Thank you so much, Dr. DeClue, for joining us.
You're welcome. Happy to be here.
Yes, we'd love to start off with asking more about your background. So you often describe it as untraditional. I'd love to hear more.
Well, I think it is. It's very untraditional. Became a veterinarian at 41 years old. I'm almost 60 years old right now. I was an athlete. I worked in different manufacturing job for Archer Daniels Midland after I stopped being an athlete. And then I became a journeyman lineman, where, you climb poles and do high voltage electricity. And I was a blue collar worker, just strictly a blue collar worker out there in the trenches, working storms, ice storms, hurricanes, tornadoes, out there putting people's power back on, building tower lines, high line, residential stuff, So it gave me a different perspective about how to solve problems, because if your power goes out, we can't just walk up and say, sorry, we can't figure out how to get your power back on, so see you later. Call somebody else, maybe they can figure it out. It doesn't work that way. As a blue collar worker, you have to solve the problem. If you call a plumber to your house, they will figure out the problem. You might not like the price for it, or you might not like the fact they might have to tear a bunch of stuff out, but they'll solve your problem. And I have that mindset the same way with horses. Is I have an education, and if you know your education and you use your education, and if you don't know the answer, then you keep researching until you find a solution to the problem. Sometimes you don't know the answer. Do you know what's causing it? But you can at least find a solution to the problem that works. So I think for me, that's why I'm very different on how I approach everything, instead of how they teach you guys in veterinary school, like step 1, step 2, step 3, like all these steps, these rule outs. You're not thinking of application. You're just thinking of, okay, I have this list. Once I'm done with that list, sorry, you guys are experiencing it right now. You're going to throw 90% of it out. I hate to say that. It's true. I think the way that they're teaching is better today, but I also think that you guys need to start hands-on, like I did as an apprentice lineman. You're out in the field all the time, learning. And then you understand what to prioritize. And then you're in class, right? You have to get through your education, and then you go back out in the field and you learn. And many people would not become a veterinarian if they really understood, day in and day out. And we'll get to that topic too. But there's a lot to this. And it's not just loving animals. You have to have the right personality and stuff to be able to make it. So I'm not the typical veterinarian. I don't think like a veterinarian. I'm not like you guys. They're teaching you how to think like a veterinarian. I do not think like a veterinarian at all. I think just like a blue collar worker. And I think that if they would teach people to be more think like a blue collar worker, I think things would be a lot better as far as you guys coming out and being able to just do the job,
Yeah, you mentioned. So what made you, that's a drastic career change. What made you think okay, I want to get into veterinary medicine? Did you think I'm going to go be a vet tech and then go to vet school, or what was that like?
So the truth is, the safest guy I ever knew got killed. A journeyman lineman, his name's Phil Edwards, safest guy I ever knew got killed. And it changed me. It rocked my world. I knew his daughter played basketball. I helped train, all these things. And I wasn't the safest. I took risks. And I just knew that if he got killed, I definitely was going to die as a lineman. It's one of the most dangerous jobs in the world. But I think that I had to reevaluate myself and go, what do I really want to do for a living? So I quit being a lineman and I became an assistant technician at the University of Minnesota. I was one of Dr. Tracy Turner's technicians at the University of Minnesota. And I was just his runner. I knew nothing. Understand, I'm I understand farms and I understand animals and all that stuff. And I could step into it, and I'm a hard worker. Like, there's nobody that can outwork me. And so I just learned, and I realized, I didn't think I was smart enough, to be honest with you. I honestly did not think I was smart enough to be a veterinarian. And when I got working as a technician, I realized, wow, these people are really smart, but they're not. Common sense has gone out. Like, I don't know where the common sense is, but it's somewhere not in this building, Like, it's so out of the building, I don't even know where the building is that has it. But we're on a whole big campus. Hopefully there's a building there that has a common sense sign in front of it. We all need to take these people, transplant them to the common sense building. There, we might solve some problems, right? It's the truth. But anyways, that's what made me. And then I applied to get into, my grades weren't good enough. I was a jock. You know what a jock is? Athlete. I think I graduated from college with, I would have had probably a 1.85 GPA. I had like a 2 point, I was lucky, maybe a 2.1. Literally, I'm serious. So, I didn't think I was that smart. I'm really not that smart. I just have a lot of common sense, and I can solve problems. So don't feel like, it's okay if you feel like you don't know anything. I feel like that all the time. And I think it's a healthy thing not to feel like you know anything. Like, you guys are going through that process right now where you're like, oh my God, how am I going to learn all this? And is it important? Is it not important? Don't worry about that. Just get through it. Just do what you're told. Go along with it to get along. Like, you just got to go along to get along right now. Just do it. Play the game. Go along to get along. But afterwards, then you can start pushing whatever limits you want with yourself and whatever you want to learn. That's the real truth. And that's why, I've seen all sides of this, and I think that you guys just have to have a positive attitude, even when you get all stressed and you're like, oh my God, I got an exam tomorrow and I got to know all this stuff. Just know what you can know. Just, don't procrastinate. You got to study every single night, right? Don't put it off. It just sucks. It just sucks, but you'll be okay. But I'm not the traditional, I just approach things differently, and you're going to find your own way. That's one thing I can tell you.
What advice would you give to students that are interested in equine sports medicine or just the equine field in general? Because I think the most unattractive thing about the equine field that I hear a lot is the pay. So I don't know. Do you have any advice?
It's a really good question. I think the biggest flaw of what has transpired is the biggest flaw of equine veterinarians. That's why we can't find equine veterinarians. And I'm going to be honest, I'm just an honest person. This is my perspective, my opinion, but I'm also an outsider to this profession. So I see things as an outsider. You guys you're going to be ingrained into a culture that I know I am not part of that culture at all, because I was older when I went to veterinary school. You were younger. So they couldn't ingrain me in that mindset, right? There was no changing my mindset. I think the most important thing is that you need to know horses. You need to know how to ride horses. You need to know how to groom them. You need to have horse experience. If you do not, it's okay. But you need to understand that if you don't, it's the mistake that we've gotten into with the equine profession, is if you don't know how to ride a horse, then a trainer is telling you what's wrong. If you don't even understand what they're saying, it's like a foreign language. If you can't ride, you need to learn to ride. If you don't know how to groom a horse, then you need to learn how to groom a horse. If you don't understand horses at all, stand on the road watching a pasture of horses. You need to understand your patient before you can even think that you're going to step into a sports medicine world where you're dealing with trainers and riders and people that do know these things. But the mistake, here's just a little pet peeve of mine. I cannot believe that veterinarians who ride, people that ride, like veterinarians that truly ride, have not solved these problems. That do not talk about body lameness, that have not solved these problems. I'm not the first veterinarian that has ever ridden a horse or driven a horse. So how is it possible that I've figured out all this stuff and all these veterinarians, hundreds of thousands of equine veterinarians that came before me, have not solved these problems? How is it possible? Now, that's the real question, right? And I think it goes back to mindset. It is how I think, how I approach problems, and how I look at a problem is different. And so any person thinking about being an equine veterinarian, it's a tough world, but it's only tough. It's tough. You have to be mentally, like, you got to you got to be able to take criticism, right? You got to walk into a barn, and this happens to me. A trainer I work for, she is awesome because she never remembers when, like, she always forgets if the horse is better. Like, I can ask her, hey, how's blah, blah, blah. And she's like, oh, I didn't know there was a problem. But if I walk in the barn, I'm like, hey, how's Harry? And she's like, she'll just lay into me. Like, he's not better, blah, like, I can't stand the right rein. I can't, I'm like, okay, well, I suck. You got to embrace the suck, like, you're going to suck. It's okay. You're going to miss things. It's okay. You're going to suck. People are going to say, this ain't any better. But the thing is, you got to look at yourself and you got to go, what am I missing? Right? And I think that's the most important thing. And it's okay if you don't know. If you don't know, you just say, I don't know. And I say that all the time. I videotape every single day of my life. And I say it a lot. I don't know. What are we going to do? I don't know. Like, I just go with the flow. I have an idea in my brain. I see the problem, but sometimes I don't know what the problem is. And we got to go through all these things to figure out what is really the problem. And most of the time, there's not just one problem. To me, it's all connected. And so I'm dealing with variations of problems. And so that's where I realized you can't just have one thing. It's all connected. If there's a chip, yeah, you can go in there and take the chip out. No problem. Easy peasy. But to become an equine veterinarian, you have to know what it feels like to ride. You need to know what it's like to drive a horse. You need to really, and you got to be a strong kind of personality where you have boundaries. There's a big problem in the equine world where ethics and morals and money, there is so much money involved. That's the thing. There's so much money involved. And that gets in the way of people doing the right thing. And it's something people don't talk about. I talk about it because I'm an outsider to this profession. I see the dysfunction. You're making money and the trainer's telling you what to do and they're winning and your name is on those horses that are winning and you're not going to say no to, a $300,000 a year account, right? Even though it's unethical, even though the horse doesn't need it, even though it's all these things, right? And I like you guys as a younger generation because you're going to say no. I love you guys. Because you're going to say no. No. Number one, you're not going to talk to me that way.
Yes.
Right?
Our generation is very good at that. Like, no is a full sentence. We will not suffer the way other people did. I don't believe that people have to suffer in order to earn their position. Like, that should
Or respect.
That should be out the window. Like, treat me well from
the beginning.
Yes.
Right. Look what I did as a woman lineman, right? I dealt with more stuff than most people would ever be able to deal with. But I also believe, here's the other thing. If I couldn't do the job, I didn't belong to be out there. And that's the real truth. I don't blame the guys. I did not blame the guys. If I couldn't pull my weight, if I couldn't pick up anything that they could pick up, if I couldn't rescue a 300-pound guy off of a pole, if I could not do the job, I did not belong out there. And the same thing goes with the equine. If you physically cannot do the job, you should not be out there. You need to work out. You need to get into shape. You got to be strong and you got to be agile because these horses will hurt you. And they don't mean to hurt you. They're going to hurt you because they're painful. And that's the thing is there's so many aspects to this. But I love you guys as a younger generation because I agree with you. Like, I paid the dues for women linemen. I'm the one. I was strong enough to deal with all that. I still am. That's why I don't really care. I never care about what people think of me. I know I'm a wonderful person. I'm willing to help anyone do anything. You stop by my farm, I'll stop whatever I'm doing. We'll hang out, whatever. I'll cook. I don't care. Treating people with respect and, that's important and you guys deserve that. But you also have to work hard. Like, that's the thing is, a lot of people want an easy peasy ride, but it's not like that. If you're going to choose equine, you're going to be out there late some nights because the trainer isn't going to accept that you're going to go home at 5:00. They're like, no more horses, man. Right? Sorry.
Speaking of which, too, I wanted to ask you about working with trainers. The ethics can get muddy. What cases did you have, or what case did you have that started horse first? Or what experience with veterinarians started the horse first movement that you've had?
Well, I'll be honest with you. Do you want to know what started it? This is the truth. I was so PO'd at the veterinary profession with the 2015 paper that came out that put the association that shivers is associated with cerebellar lesions in the Purkinje cells or whatever, deep central nuclei in the cerebellum. And it was actually a veterinarian. This is the story. I was looking at, I've never told this story out loud. So I'm going to tell you guys as veterinary students so that you guys can understand the things that the egos in equine, like all the stupid stuff that, like you say, people don't treat each other with respect, and we wonder why people don't want to go in this profession. There's a lot of positive to it too, but I was going to look at a horse for a pre-purchase for a client of mine. I didn't know the horse had shivers. The trainer I work for didn't know it had shivers, but it was priced at something like $750,000. And at that time for a $1.50 horse, it was like 1.3, 1.4 million to get a horse that jumped $1.50. Okay. So we were there, we were looking at the horse, and I got introduced to the trainer through the trainer I work for. And I said, she said, why is this horse so cheap? It's got a great record. And he said, well, the horse has shivers. And I'm like, it was December 22nd, 2015. Actually, I have a medical record on it. That's how I know. And so I'm like, I just walk over to the horse and picked up its right hind leg, and she shivered really good, abduction. And then I picked up the left hind. It wasn't too bad. So I looked at the trainer. I'm like, 3-4 treatments, it'll be good. Jump $1.60. She was like, cool, So, and then the other trainer looked at me really strange, and I looked at him really strange. I'm like, I said, has your veterinarian treated the horse for shivers? And he goes, you can treat shivers? I'm like, well, have they treated it? And he goes, I don't know. She's on the other aisle. So we walk through this fancy dancy barn with all these chandeliers and all this stuff. And I go to the other side, and she's there injecting horses, and I'm tall, and she's kind of like this height to me. And so the trainer I work for introduces me to her. This is my veterinarian, Audrey. I'm dreadlocked, tattoos. I'm dressed like a regular person, blue collar worker. And I said, what horse? I looked at the other trainer who's there, and he says, blah, 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 mare. And I said, well, what have you done with her? And she goes, well, I injected the coffins, the stifle hocks, and the SI. And I said, like, literally, I knew nothing. I said, well, did you treat the horse for shivers? And she looked at me like I was a complete idiot. Like, literally, she folded her arms and said, Stephanie Valberg published a paper, blah, 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 December 2015. Sorry. And I'm like, okay, that's right now, 2015. And she gave me the title, Shivers Associated with blah, blah, blah. And then she said Purkinje cell. And I'm like, what in the world is that? Here's my brain. What is that? And then she said deep central nuclei. Like, she randomly said the whole paper title. I'm like, oh my God, she's so much smarter than I am, but who cares? So the deep central nuclei came out, and then she said the word cerebellum. And I was like, there's a word I know. Okay. And then I'm like, I don't care, like whatever paper came out. And then she said, but I knew what cerebellum was. And she leaned into me with her arms crossed, literally leaned into me. And I thought, I'm being a lineman at this point. I'm thinking, I'm so going to headbutt you if you get closer, right? Like I'm just honest. And she leaned into me and she said, and if you were a doctor, you would know that if it's in their cerebellum, there is no treatment. And I'm like, I almost run over the trainer, and I can see the horse out in the arena. I'm dead serious. This is how it started. I just walk, and the trainer comes running up, and she tells the story actually better than I do. And she runs up and she goes, holy, I can't believe you didn't punch her. And I said, if I was a lineman, I probably would have, but I'm a veterinarian, so I have to be more responsible about my actions. And then here's the other trainer running up, and the trainer's getting on the mare, and he runs up and he goes, are you serious? You can treat shivers? And I turn to him because I'm mad. I'm like, who are you to get up in my face and treat me like I'm a stupid idiot, right? These are my thought process going through my brain. And I turned to him and I said, why would I say I could do something that I can't? I said to the trainer, how many of these horses have we had and we fixed? She goes, well, thus far it's 6 or 7. They're all great. And he goes, oh my God, would you treat this horse? And I got another one in the barn that I can't sell because it's got shivers really bad. And I said to him, I turned to him directly right to his face. And I said, I am so sorry for these horses, but why don't you go talk to your academic vet and let her figure it out? That's literally how it all started.
I'm so sorry. That is.
I know. You think about this, you guys. This is why I'm telling you this story, is because I went home. It was late. I called a friend of mine that works out of Washington State, Kathy Saino. She did the research with me. I said, what in the world is this stupid paper? And she said, we had it in book club and we threw it out saying there is no way that anyone is going to believe that a cerebellar lesion is associated with shivers, clinical signs. Well, guess what? The whole equine veterinary world adopted that over 5 cases. And I couldn't have that happening. And literally that is why I started the podcast. That is exactly why I started the podcast. And I realized I was doing things that nobody else was doing. I didn't know this, you guys. I honestly did not know that no other veterinarian in the world was treating shivers until that day, December 22nd, 2015. Now, number one, there's a lot wrong here, right? How other veterinarians treat people, right? Equine veterinarians treat each other. How veterinarians treat each other, period. It goes back to I love you guys as a younger generation. But this is what you get yourself into with the equine world. People don't play nice because there's a lot of money involved. And we should be helping each other. But that's what started, literally, that is exactly what started all of this. Somebody getting up in my face and telling me if I was a doctor, knowing full well I was, pretty much calling me an idiot, right? So you don't do that to someone like me because I'm going to prove you wrong. You know, I just don't. And that, honestly, I have to be honest with you. I am so grateful to that person. I actually know who she is now. I didn't know I only found out like a couple of years ago. I don't really care. It doesn't matter to me. I'm so grateful to that person. Do you know why? Because she made me a better veterinarian. So there's a lot of good coming out of this story. I am so glad it happened. There's a lot of wrong with it, but there's a lot of good that has happened. And that's what I need to tell you guys is there's going to be these wrong things that happen to you. But look at it from the bigger perspective. If she had not done that to me, nobody would know who I was. We wouldn't be doing this interview. I wouldn't have come up with body lameness. Nobody would know. I'd just be living in my little bubble of my clients and nobody would know who Audrey was. So there's a lot of good, you guys. So that's what I mean. At the moment, it was like, you're lucky I didn't headbutt you. You know, like I'm a lineman. I mean, it's the truth. But that's what I mean. I did it because I knew I was doing something that other people weren't. And I was learning all these things for horses. And that just I was like, this can't happen. They can't be killing these horses and sending their brains off and finding nothing because there's never been another paper about it, right? If it was true, right? God knows they had a lot of Budweiser Clydesdales and other horses euthanized for nothing, or they could have just treated. And I didn't know then either. So, there's a lot of woulda, coulda, shoulda, whatever. It doesn't matter. We have to always look at how that happened for a reason to push me to where I'm at now to be able to help you guys. And these are sometimes the things you have to go through to look at the bigger picture instead of just looking at that as a negative thing, right? It's kind of like learning all the stuff you're learning. Look at the bigger picture. When you're getting out in those days where you're like, this sucks, but tomorrow's going to be a better day.
Yeah, I think that no matter what profession you go into, some are worse than others. Like, I think we've talked about it with Dr. Quammen. I think it gets really bad with the vet techs. And I haven't been in the equine vet clinic world so much as I've just, kind of seen the breeder side of it. And even that can get really crazy. And like, I know what you mean. I've been to the horse shows, even like a little 4-H horse show. Oh my goodness. Pony. It gets
Right.
crazy. I don't know what it is. And it's to the point where in vet school, we're learning about crazy horse people. That's just a thing.
There's crazy dog people. There's just crazy people.
There's
right?
crazy people in general, but there seems to be a high proportion of horse people that like to think, I'm not saying they don't, but not all of them do. There's this dynamic between veterinarians and horse owners where horse owners tend to think, okay, well, I want to do it this way. And the vet says, well, I think you should do it this way. And nobody can find an agreement. And I think that's another huge turnoff to go into equine. Because I don't know, I've been telling this story recently because I think it's hilarious, but I was giving a 4-H presentation to 9-year-olds about parasites in horses last semester for a volunteer service learning whatever. I'm just giving this little tiny 15-minute lecture about parasite prevention, dewormer, grooming, the basics to 9-year-olds. And at the end, I gave them a little quiz and I was like, okay, so what did we learn about today? What are some methods of prevention that I talked about? I said it in 9-year-old terms. I don't remember what I said. And then they raised their hands and one of them was like, oh, dewormer, grooming. And then the last person, she was like, diatomaceous earth? And I was like, sure. Whoever told you that, sure. I didn't say that, but cool. If you want to, I'm a vet student, I'm a first-year vet student. I'm not the end-all be-all. I'm not saying you're wrong, but I have not I don't think, as of right now, that that's a accurate or a effective prevention method, but go ahead.
It's a really good point, because the problem is that in small animal, we can give people more answers because we can do a dogogram, catagram, hamsterogram, snakeogram, right? We can do all these grams. We can throw them into any machine and go, there's the problem. I think part of the issue with the equine world is that we, as veterinarians, have not been able to give people answers. So if you can't give people answers, and the trainer and the rider, whether it's an amateur or a professional trainer, they get back on their horse and they go, it still feels like crap. I just spent $1,500 of my hard-earned money and it still feels the same. So that's kind of the problem, right? And I think that is something that has gotten the veterinary profession into trouble, to be honest with you, because nobody can give these people answers. And about especially lameness, body lameness, and why a horse is crooked, why a horse, only hops and transitions. Nobody's been able to give them answers. And that is the problem. That's why people make their own stuff up. And that's why they don't listen to the veterinarians. Maybe not a 9-year-old with parasitology, but it's okay. It's the same problem. It's the same problem.
They want a solution and they're not finding it.
That's right. And that is the most important thing, you guys, is we have not been able to give these people answers. We can find this teeny weeny little hock spur and we're going to say, that is your problem, why your horse feels horrible. They inject the horse, you get back on it, and it's like, this still feels like crap. The horse's haunches are still to the right. You go back to the veterinarian, right? What do they say? Well, we missed this, blah, blah, blah. They got to do more stifle injections and block your horse more and everything. You get back on your horse after you spend another $1,500. Now we're at $3,000. Horse still doing the same thing. It's still dropping out behind. Haunches are to the right. This is the issue. This is why we're in the situation we're in with people not wanting to go into the equine veterinary world. And that's why a lot of people do not have respect for equine veterinarians.
Is there an approach they can have instead? So I was just taught about injections for like the first time. And they're like, you're going to be doing this a lot. And I know that because that is the fallback of the industry. And sure, it does provide relief. But then my thing is they come back to these issues. It's only a matter of time. So we're putting a Band-Aid on an issue and also putting them at risk for other things. So what do you do instead as in your realm of veterinary medicine to treat horses?
So when we ride a horse, they're supposed to be straight, right? Just like this line right behind me. Straight. This is a horse. If they're crooked, there's something really wrong. And so that's what we haven't learned. And the distal limbs, yes, they have issues down there, but the majority of them come because their body is not straight. They need to be straight. We ride them to be straight. So nobody teaches biomechanics. And so you have a body that's not straight. It's kind of like a person with back pain. Their knees start wearing out if you have right-sided back pain, your left knee is going to start wearing out. It's all the compensatory things that you can inject their hocks. They'll feel better for a couple weeks because the lower joints are not working. They're taking the load of a biomechanical dysfunction of the axial skeleton. And people don't even understand how the axial skeleton works together. And that's what I kind of have figured out. And I had to figure out because I ride my client horses. I get on them. I'm like, this feels like crap. Where's that coming from? Right? And why is a horse like that? I mean, I'm just a real person. I just go, man, that feels that. And it may look beautiful. Like a horse may look beautiful on the lunge line. And then you get on them and it feels like horrible. They'll just throw you around where you can't have your balance. That's all body lameness, you guys. If you get on a horse and their diagonals are different, it's body lameness. They're body lame. They're not foot lame. They're not limping. They're not any of that. So I think there's a lot to this, but I work for trainers and I listen to my trainers and I train my trainers to understand that if a horse is resistant doing something, it's because there's something wrong. And that's the real truth. And the equine veterinary profession is really horrible at understanding that. It's really, really horrible. It's so horrible at it. Horrible. That's why I'm different. That's why I have so much respect for Sue Dyson and the ethograms. That's the beginning.
You've been mentioning body lameness. Could you kind of give us a definition per se? And like, what are you looking for when you say body lameness? What does that mean? And when you decide what part of the body or all of the body, what are your next steps?
Well, body lameness is axial skeleton lameness. I start calling it body lameness because literally my clients, the trainers I work for, they're like, axial, what does that mean? And you want to know something? The body workers know this stuff. They know it better than veterinarians. I love training body workers and physiotherapists. I love training them. I love teaching and training them. They are so much easier to train and teach than veterinarians. Now, isn't that interesting? But body lameness is only axial skeleton. And the body is in 3 sections. And that's a whole complex, how it's all connected, because it's all connected. And you got to understand how it's connected and how it all works together. And that's what I'm teaching in the fall. I'm writing a book on biomechanics so that trainers can read it, students can read it, everybody can read it. It's not going to be complicated. It's not going to be all this crazy. I can't read some of these veterinary books. Can you guys? I mean, you guys are in the midst of it. I can't read some of the stuff that's up here in my cabinet. I'm like,
I don't try to, is the answer. Like, I don't think I've ever tried to. I go with what my professor teaches me. That's what's going to be on the test. And then if I feel like reading something crazy, I'll read, like I just read Cowboy Medicine. My grandmother, who's probably watching this, hi grandma, she got me a book called Cowboy Medicine. And it's by Dr. Paul Christensen. Yeah. And it was like, oh, gee, it's a little bit outdated. Some of the stuff I was reading, I was like, oh, we don't do that anymore.
I know.
That being said, it was still very interesting, and it was about Canada and like OG cowboy, like working cows 24/7, C-section, low technology medicine in the 70s, 80s,
Yeah.
90s. So it was definitely very interesting, but that's the type of stuff that I prefer to read instead of like, I don't know, papers. I probably should. That's probably more beneficial, but right now what's interesting is I want to hear people's real experiences. And in the book he would talk about, here's what this client thought about this and here's my real life experiences. I think that that's beneficial to me, even though it's not really applicable because he was doing this 30 years ago and
it is applicable. I'm telling you guys, all I have is my hands, my eyes, my ears, taste, smell. That's how I do everything. I mean, I have an ultrasound machine and shockwave machine, and that's it. If I need x-rays, I send them off. I don't need to have an x-ray machine. I don't really care.
I don't want to ever see a horse x-ray ever again in my life. I know I will, and I'm not even done.
You're going to.
Yeah, I know I will. And I literally still have to test on it because I think we just did the thorax this week or something. So I'm still learning it. But I was telling y'all before the podcast, like we learned all about just learning the different views, just the views of the distal limb to diagnose lameness is like one of the hardest things I've had to do in vet school for no reason.
How is it possible that the veterinary profession is latched on that the limbs are the most important thing in a horse? I mean, we ride the horse to move the limbs. We don't ride the limbs to move the horse. I mean, I'd love to see a limb of a horse saddled up, right? Like, just go on, get on there. Let's see what happens to you. It makes no sense to me. Like it makes absolutely no sense, especially, but the old ways, I find the old ways, people had more, it goes back to the common sense building that every veterinary school has to have. The old ways were common sense. Now, some of the stuff is outdated, but it's the fact that it's a horse. I don't care what discipline a horse is. It does for a living, whatever. It is a horse, right? A cow is different than a horse, not only intestinally, but everything else, right? It's different. So you're going to have different issues, but a horse is a horse. Whether it's a miniature horse, a mule is a horse, a zebra is a horse, it's an equid species, Body lameness is axial skeleton and how it all works together. And I forget about the toothpicks down there because you can look at a year's worth of history just looking at their feet. That is a year. That is 1 year. Tells you everything about a horse. I can look at a horse's feet and say the horse, and people are amazed by this. They go, I'm like, okay, you have a lead change problem from left to right. I haven't even touched the horse. I just walk up to the horse and look at it. And they're like, yeah, the left lead is better than the right lead, and left to right lead change sucks. And they're like, how did you know that? And I'm like, I'm definitely not a savant. I just look at the horse's feet, gives me a year's worth of history, and I look at the body. And that's all you need to do. I can tell people how a horse rides by just looking at their body. and their feet.
What kinds of things are you looking for when you're looking at the feet? Are you looking at kind of the wear and if it's uneven, or what are you looking for?
One being bigger than the other, weight bearing, right? Everything. You look at musculature, if they're atrophied someplace, or if they're asymmetrical someplace, if their neck is hollow, it tells you the whole story. If they're sweat patterns someplace versus another, I mean, people are always amazed by it. I'm like, this is all they do. I'm quite bored in practice, to be honest with you. I never get, well, I have a challenging case here now, which I love. It's the only thing that stimulates me, things that are really, really challenging, besides talking to you guys. And I enjoy doing that too, teaching people and helping people. I really enjoy doing that. But, it's learning. It's actually observing. It's like you got to sit back and, like I said, you need to look at horses and you got to learn what they are and what's normal, what's abnormal. People, the veterinary, you are not going to learn what normal is. And that's kind of the issue.
Love to hear about, I'll give a little preface as to my background and what drew me to your work. So I grew up with horses, riding them. A big proponent of welfare and correct husbandry, because I believe that is the source of like 90% of our issues in the equine world is how we're managing them. But on the riding, I got a chronically lame horse that I was telling you about, and I was told really there were no options. And I was like, well, he's only 12, so I'm kind of going to refuse to believe that. So I started doing talking to body workers, talking to chiropractors, people who weren't going to tell me no, but they were going to say, well, let's adjust him. Let's give it time. Also, the joints take a long time to heal. And I was like, okay. Then I was told you have to do hooves. So then I went to farrier school for like a week. I am no expert by any means, but I trimmed mine and I tried to pay attention to how their hooves change. And he's not perfectly sound. I think majority of horses aren't, but I can ride him. And he is happy under saddle. And I think that's what people are ignoring. Like when I get on, my horse is happy about it. He actually doesn't let me get off. He wants to keep going.
That's a really important point, what you just said. I think I see so many horses. I think we manage I only do show horses. So they're managed very, very well. They're taken care of very well. So, but I think the starting process, like how we're starting horses, we're starting them so young. We're putting so much pressure on them. We're using ill-fitting equipment. They're not happy. They're not happy. We're tying up to a wall for 8 hours, right? People are tying them around for a problem that is an injury. And we're not accepting that young horses get injured. It's crazy to me. A kid can get hurt playing pee-wee football, right? But we can't accept a horse gets hurt when it's a year, 18 months old to 2 years old. But what you said about being happy, I see so many horses that are so miserable, so painful, and they're out there doing their job, but their ears are back, their tail's swishing, their head's up over their back, and it shouldn't be that way. It shouldn't be that way. We as a profession we wouldn't be talking about social licensing if the veterinary profession would have stepped up and said, this is not okay. We know these horses are in pain, but see that's the big lapse. They didn't even know the horses were in pain. The veterinary profession didn't even know the horses were in pain. They just said, still to this day, veterinarians say horses are behavioral. I'm like, oh my God, you have got to be better. You have got to be better as a veterinarian to not understand that your patient is so painful and you say it's behavioral because you can't pick up its right front leg. Unacceptable to me. There's a reason why a horse can't pick up its leg, especially a trained horse that knows how to pick up its legs, right? So I think those are all the things that if a horse is happy, they want to keep going. They want to take you for a ride wherever. They don't care where you go. They want to go in the ring and compete. They want to do their job. They want to be with their human. But any horse that's girthy, any horse that can't pick up a leg, that doesn't like to be groomed, that tosses its head when you bridle it, all these things. You bring the saddle out and it's pinning its ears, it's moving in the cross ties. It's painful. That's where the exam should start as a veterinarian, is in the stall. You should be watching your patient in the stall, slowing down, watching your patient in the stall, and then the whole process of grooming, tacking up, everything. And that's where I'm different, because I never rush. I don't. I don't rush. Everybody loves it because we all get to know each other really well because we're all just standing there at the stall watching the horse and talking. We bring the horse out, they get groomed, right? All this stuff. You have to see these things. And so we're missing all this. And that's where you guys can be different. That's where you can be different, is you can change that to make people aware that this starts in where they live, in their house. It's like watching your grandmother that has a bad hip get up out of the chair, right? It's not easy. So, it's observing. I observe so much. That's what I do. I can see it's a curse too. It's a real curse. But for you guys, that's where you can be different. That's where you can start teaching and understanding that it starts. Go to the large animal hospital and just watch horses in their stall. You'll see a pattern. You'll start recognizing the pattern of pain. And I think me working at the University of Minnesota, I saw these horses in their stalls post-surgery, prior to surgery for lameness with Dr. Turner, how painful they were. And I knew the signs already, but because I'm a horse person.
What do you feel for when you said that you ride your clients' horses? I think that would shock majority of equine vets. What do you feel for? Michaela and I both ride, by the way.
What they feel like a horse should be straight. If you get on a horse and their neck is over here and you got to pull on the left rein because their neck is over here to the right, there's something wrong. If you walk and their walk is like they're just this, they're lame. If you're being shifted over to the right or shifted over to the left, they're lame. There's something wrong. They're body lame, okay? If they're not straight, if they don't push behind, if they drop out, or if their diagonals are different, they're lame. That's body lameness. They might not be head bobbing lame. They may not any of that, but a horse should be symmetrical. They should just flow. I mean, riding a horse that has a beautiful trot, you just sit there. You're just like, hello, world. How are you? This is so nice. And then you canter and you're like, yeah. You can just sit there all day long, just cantering along. You want a lead change? Here we go. Lead change. Canter the next way, right? That's what a horse should feel like. They're born symmetrical. They're born for symmetry. They're not born for asymmetry.
Sometimes you'd like to think that the way that they get hurt.
I have these on my farm, and I tell people this all the time. They complain about how much horses cost, and I say, okay, here's my thing about horses, is these two are the cheapest horses you'll ever buy, and you still can ride them. And the best thing to do is dig a hole, throw your money in, literally just keep throwing your money in. And then one day, unfortunately, you're going to throw your horse in there and then finally you can bury it. That's horses. Besides these two, you don't cost anything. They cost me nothing except for, actually, they were presents from my neighbor, Paige.
If you were in charge of the veterinary schools, besides adding a common sense building, how would you teach lameness? And what would you want to instill in our generation?
Biomechanics. People do not understand how a horse works. They don't understand. This is why people are so dissatisfied many times with their job as an equine veterinarian. It's because you can't explain things to people. People come to me, I can explain to them, well, this is why. I can talk to the trainer, this is why their head's this way, this is what we need to do, and then they get back on the horse and the horse is better. Because I can explain why, and then it's just learning how a horse works, how it actually should work, and why we're having the issues that we're having, and being able to give people answers of, I have to do this first, and I got to do this next, and explain to them there are no quick fixes. We got to accept that there's injuries that happen, and it takes a long time to come back, sometimes years as an athlete. And the equine world is not, for you guys, you don't understand biomechanics, so you can't give people a timeline of, oh, this is really bad. And we're looking at a year to 2 years, and they're like, you're kidding me. I just spent, $600,000 for this horse. Well, that's the reality. Because your horse, unfortunately, has a serious injury in its axial skeleton, and none of this gets better quickly. It's not like a broken bone. So, it's all these things that if I was going to teach, I'd start the structure by teaching biomechanics and having people understand how a horse works, and then teaching them at the same time, watching a horse in a stall, watching them walk out of a stall, just teaching people to slow down and observe your patient and to listen and to do a physical exam. People do not know how to do physical exams. They don't know how to interpret what the reaction of the horse is. And to me, it's if it doesn't hurt, they don't react. But it's also how people palpate. And they don't train you guys how to actually palpate or how to do range of motion or how to understand biomechanics. That's where I would start. All you have to do is look. It's all there. Their bodies will never lie to you. What's there is there. And never let anyone, this is one thing I'm going to tell all you guys, is don't let anyone tell you that what you think and what you see and what you hear and what you know, don't let anyone persuade you out of it. That's your side of it. That's what you hear. That's what you smell. It may be different than them. There's not a right and wrong in that. Ever let anyone tell you that what you see and hear and taste and smell, what you think is wrong, trust your intuition. It's there. Don't let anyone persuade you out of it. Anyone. Because God knows I tried enough horses up and down the hallway for Dr. Turner, and I was on 95% of the time. But I realized I wasn't. I really wasn't. And I was older. I didn't let anyone persuade me out of it, because you couldn't persuade someone like me not to accept that what I hear and see and think is what I see. I'm just not that person that's going to be influenced by it. So that's what I'm telling you guys. Don't let anyone influence you. If you think there's something wrong with that dog, if you think there's something wrong with that horse, it's there. But you also have to, you have to not have your emotions in it, right? You have to have it factual. No emotional state to this. And that's one thing I can tell you too, is we as veterinarians, we need to check our emotions and we need to keep those at bay. You have to have empathy for your patients and compassion for your patients, but that cannot override your factual, logical, scientific brain. Does that make sense? Because some people get things too emotional, and I'm not like that. If you want to be a veterinarian, you got to accept that there are going to be bad outcomes. You're going to have to euthanize animals. You're going to have to see the worst. And it's upsetting. It's upsetting for me. But you have to learn how to deal with that. And if you're not strong enough to deal with that, maybe go into research or something else instead of practicing as a veterinarian, because it's a tough job. It's a tough job.
You're very right. I think even just being in the clinic, even not as a veterinarian, vet techs are stressed out. There's high turnover rates for many, many reasons, but one of them is the emotional load.
Here's my biggest thing. You don't want animals suffering. We don't want to see our own loved ones suffer, right? Even though, and we have the gift as a veterinarian to be able to take our animals out of suffering. And people can become selfish, right? And they lose a rational aspect to this is suffering. And I feel like it's our job as veterinarians to say your animal's really suffering and it's very, very painful. And this is hard for all of us, but we need to do the right thing for your animal, right? And if you cannot have that conversation, and it's hard, but you also have to, if you want to be a doctor, these are the things that you have to work on. I mean, mental illness we all love animals, but you also have to have that emotional integrity and emotional control to understand you're there to not only help the human, but you're also there to help the animal. And the human aspect of it is a very big thing. And you have to be good with humans, and you have to have care. You have to care, you have to care, but not, and you have to guide the owner too. Like, nope, I'm sorry. This is not, it's hard. But if you can't handle that, and it wears on all of us, but you also have to, I always look at to the positive of everything. What did this teach me? How am I going to learn from this? What can I do to be different to be able to help the next patient? Or what did I say that was incorrect that I need to be better at? How did I approach this? It's always, to me, it's self-reflection. It's always having self-reflection of trying to be the best human being that you can be and to actually care. I find people stop caring because they take all that stuff on and it bogs them down. And I'm just telling you, don't let it do that. Keep your positive attitude. Realize why you're doing this. You're doing this to help other people and animals. And it's a great job. It's an exceptional job.
That's amazing. I think I'd like to wrap us up on, for people who want to learn more, because our education will not necessarily provide resources for biomechanics, where can we as students look, or pre-vet students or horse owners, or just anyone who wants to know more, where can we learn about biomechanics?
You can come to me because I'm going to be teaching courses. You don't have to be a veterinarian. You can be a veterinary student, you can be a trainer, you can be a veterinarian, because you guys are important to me. The veterinary students are very important to me, because if I can help train you how to think about problems, then you're going to have you're never going to have to worry about business. I'm very fortunate. Everybody's worried about money, right? How much, like you said earlier, like the salaries are so bad for equine veterinarians. Well, if you understand what I do for a living, and if you start and you develop the skills, you never have to worry about business. You never have to worry about not having business. People will come to you because you care, number one. Number two, they want solutions to problems. And number three, the horse gets better and people don't have to spend as much money. So when you start treating body lameness, the lower limb stuff becomes minimal, very minimal, very minimal. And that's the key to it all. That's what I've learned. I've seen the pattern where horses were getting their hocks and stifles injected and coffin joints injected every 3 to 4 months. And it's this repetitive, oh, it's time, it's time, it's time. If you take care of the body that is responsible biomechanically for allowing the joints, the lower limb joints, to move and work correctly and load correctly and not unevenly, the amount of work you have to do down there is very minimal. Isn't that a concept? Isn't that a huge concept? Hey, one thing, can I say one thing, you guys? So one of these questions, and I have to tell you, one of my clients was here today, and she's Harvard trained. She's a Harvard professor. She's a very good client, has great horses. Actually has a horse that had shivers in all 4 legs. The thing that you guys have to realize, and she said, when she read, I gave her guys the questions, and she's like, you tell those ladies that these are Harvard approved questions, because we didn't get to all these questions, but that's okay. We can do a better podcast next time and actually answer the questions. Yeah. But it was fun. It was fun getting to know you guys, and just kind of telling stories and stuff. But we should answer these questions and you guys come up with more direct ones. But she said, Anne told me to tell you, like, you guys are, and I told them, this is the future, Anne. You guys are the future of what I have started, all because of that one veterinarian in 2015. So my job is to help you guys to develop these skills, but you have to always realize that horses will never lie to you. Your patients will not lie to you. Horses will never lie to you. So please, if you know better, you should do better, right? And so with all this, that's what I need. I want you guys to know that please tell your classmates everything, that what you see, the horses will never lie. But just slow down and listen, and don't get overwhelmed. All right.
I would love to do like a part 2. We could schedule it, and maybe a case-based one with these.
I'd love that.
That would be phenomenal, because I grew up always wanting to be an equine veterinarian. I do love to see everything, though. So I'm kind of like, give it to me. I'm at least going to attempt to try to fix it, because I hate the feeling of sending it to someone who's going to charge 5 times as much, and it might die anyway. So I'm just going to do whatever I can. So, but I am frustrated by the industry, and I want to learn more. So I'm like, oh, you talk about these things, but I'm like, how do you see that? How do you recognize that? What can I do? What can I tell them? Because I'm tired of getting my horse injected, and that's like my one.
Well,
option.
If you want, here's the thing I can tell you. If you want a performance horse, they're going to need to be injected because there's wear and tear.
Yeah.
And that's the real truth. I mean, if you want to be an athlete, you're going to have injuries and you're going to have to be treated. And it all doesn't entail injections, but it entails a lot of other things besides just injecting. And it's all it's a whole nother realm of rehab, physiotherapy, all that stuff. I mean, that's a whole nother level that I teach. And it's easy. Once you start understanding it, it's easy. But if you want a performance horse, if you want a trail horse, fine. You're not going to inject it unless it needs it. But a performance horse, it entails advanced medicine and things. They get injured.
Yeah.
So we could do something with case-based.
That would be amazing. We actually just had, so funny that we're talking today about performance horses. We had an FEI veterinarian talk to our equine club the other day and talk about going through the process, and it takes like 20 something years. He was on like the Olympic, but I was like, What does this really entail? Because these are pretty much always lameness cases. Like, what is the process of dealing with millions of dollar clients where, like, you need to get them in the ring because we've had years of training leading up to this. And I'm looking at their horse and being like, I know that is a champion dressage horse, but they're lame. They need 2 years of rehab and they need to not be riding for months. It's like, how do you even bring that to them?
That's the whole issue, right? And that's a whole nother realm of discussion that unfortunately the horse many times is sacrificed because the veterinarians don't tell. They say they have a suspensory, so at least you have 9 months, and then the horse goes back and then it's injured again. I just saw it literally today. I just saw a Shivers horse that he's 19 years old now. I started treating him 4 years ago. The horse couldn't even walk and he shivered so bad in all 4 legs. And today I could pick up all 4 legs, no problem. His body looks beautiful, everything.
What do you treat Shivers with? What is
that's a whole nother girls. That's a whole nother. I would love to have you guys. No, I'm really serious. I'm here to help you guys and, students and that. It's hard. People want to come and work with me and do externships and stuff. It's hard. I travel a lot, but I do teach. And the biomechanics is going to be open to you guys, especially you guys as students. I'm here to help you guys. You guys are the future. There is not going to be any equine veterinarians.
Like 70 to 80% draw, or maybe even more
now.
Draw.
It's more than that. You guys, I just had a veterinarian call me tonight, and she had left a voicemail. I called. You always play phone tag, and she has a 2-year-old horse that has really bad sciatica. And her name's Allie. She's up in New York someplace, but she's going to go see a veterinarian up in Canada that's training with me and be able to treat the horse. But she's like, I don't understand why people just don't pick up the phone and call people like you and you just say, hey, I can't, this is what you can do. If you can't do it, then here's somebody that can help you. She goes, we're not going to have people because of these factors, right? Nobody wants to share clients, and there's so much, and that's kind of the issue, right? We all need to help each other. We need to help each other, not be on islands away from each other. And that's my goal is through what I've done, I'm trying to make a family where people are like, it doesn't matter what letters you have behind your name, just come. We're all the same. We're all DVMs. You just got more letters. Doesn't mean you're smarter, just means you went through more stuff, right? Because being smart is only dependent on what you can solve as far as problems. And it's not about right and wrong answer. Sometimes there's not a right answer, and many times there's not a wrong answer. So that's what everybody wants, one answer. And I'm like, I don't have one answer. Lame, the whole thing. And I think that is the most important point.
We are very grateful. Thank you so much.
You're welcome.
I would love to do a part 2 where we go. I know we hit a lot of the questions a little bit less in depth, but if we do a case-based part 2 where we go over more of the neurology and the biomechanics and things that people can look for,
absolutely,
even incorporate videos if
we can. If I can,
yeah, that would be great. So it'd almost be kind of like a lecture, but people can see. Talking. So I think it would be really helpful.
I can share my screen. We'll start with the simplest things, and we can put a case up so they can see it. And I can go over an exam.
Yeah, that would be amazing. That would be absolutely amazing. Michaela,
yeah, just walking through, what are we looking at? What are we looking for?
Right. Thank you so much, Dr. DeClue.
Well, thank you for listening to the Vet Files, and thank you, Dr. DeClue, for coming on today. But you can find the Horse First podcast on everything. I figured so, thought I would check. And you can find the Vet Files on YouTube and Spotify. And we'll see you next time.